Well, for the first time, Germany's new health minister laid out his strategy to get the pandemic under control. Karl Lauterbach, himself a highly regarded virologist, is accelerating Germany's booster campaign, provided that there is no shortage of vaccines. Unfortunately, Lauterbach says there is currently not enough for the whole country.
We need about 50 million booster doses and 20 million first and second vaccine doses. That means that the current demand is not completely covered. But that's not the most important point. If we use our scheduled deliveries for the booster campaign, we'll simply be too slow. Right now, the booster campaign will be finished at the end of March. And in all honesty, we can't work with that.
All right, for more now, we want to bring in our political correspondent, Simon Young. He's here in Berlin. Good evening to you, Simon. You know, how in the world is it possible that Germany has a shortage of vaccine doses as we, end 2021?
Well, Brent, the new German Health Minister Karl Lauterbach was asked that in his press conference today, and he said he's really not happy with the level of vaccine supply here in Germany. He did say the previous government had not taken up some options to order vaccine, but that was back before the appearance of Omicron. He said that if Omicron had not appeared, then there would be enough vaccine in the supply. But now, in order to deal with this rapidly spreading new variant, it's really very important to get the booster campaign and indeed the rollout of vaccines generally really going forward fast. So Germany's putting a lot of pressure there. They did a record 1.5 million vaccine doses on Wednesday. So things really are moving forward fast. But in order to keep up that pace, they're going to need more vaccine. Where are they going to get it? Well, in some cases, they can buy from other European countries. Bulgaria, Romania, Poland and Portugal were mentioned. They've got doses that for some reason they're not using, so they may come. Also, the minister's saying that he's pulling forward vaccine that's already on order from both Moderna and BioNTech. So there are various plans afoot to get hold of more vaccine more quickly. But, this really is a race, given how fast Omicron is going to be spreading.
And Simon, Germany was already battling a fourth wave of coronavirus infections long before the Omicron variant emerged. What has this new variant done to efforts to stop the fourth wave?
Well, so far, Omicron is not dominant here. The Delta variant is still dominant. But the Lauterbach, the head of the disease control agency here, he was saying that there are several hundred cases of Omicron in Germany now, and they're spread around all the German states. So it's only a matter of time, he said, before Omicron is the dominant variant. And Karl Lauterbach, the minister, said that he'd been speaking to his counterpart in the UK, Sajid Javid, painting a very gloomy picture, as you've already mentioned, of the Omicron spread there, with a doubling time of just 2 or 3 days. So they're extremely worried here. They're worried because intensive care units are struggling. Some of them are at the limit, and they're particularly worried looking at the Christmas period. Lauterbach said he doesn't want Christmas to be a festival for the virus as well.
And Simon, Christmas is just around the corner. We know that the British now face travel bans if they want to go to France. Are there any other holiday travel restrictions in the cards for people traveling to and from Germany?
Well, people from most countries can come to Germany, but people over 12 have to show either a negative test, or that they've recovered from the disease, or that they're fully vaccinated. And people from some countries, such as the United States, they need to either be fully vaccinated, or they need to have a very good reason that they can tell the authorities why they need to come to Germany. Some southern African countries, people from there are being told that they can't come at all to Germany. And it's worth knowing visitors in Germany will have to obey the state rules. They vary from state to state. And in some places, some of the states are saying that they don't want overseas visitors travelling there. So if people are coming this Christmas, it's going to be a very different experience from normal visiting Germany over Christmas time.
Yeah. DW's Simon Young with the latest tonight in Berlin. Simon, as always, thank you. Well, children between the ages of 5 and 11 are now being vaccinated here in Germany, a step many parents have long been waiting for. We have a look now at how things are going here in Berlin.
Julia was lucky. The 9-year-old girl was one of the first children under 12 to get a COVID-19 jab here at a vaccination center in Berlin. Julia knows why she's come. Well, because it chases away Corona, and I think it's just good. Julia was a premature baby, born 3 months early, and very, very often we were in the hospital with pneumonia. She had to be on a ventilator, and we don't want to experience that again, no matter which virus. Just like Julia, all children from the age of 5 are now able to get vaccinated in Germany. In vaccination lines set up especially for children, they receive a lower dose than the regular one. Many parents have been waiting for this step, given the high COVID-19 cases among 5 to 11-year-olds across Germany. We have the highest rate in this age group. In Berlin, it's between 700 and 800. In other German states, it's much higher, and there is a great risk of infection. And the course of the disease among children is not always mild. Special locations have been found to make getting the jab more attractive for kids. Here in Berlin's Nature Museum, children get a free ticket to see the dinosaurs after being vaccinated. By including younger kids, politicians hope to finally get out of the pandemic. The more vaccinated people we have in Germany, the better we will be able to fight the COVID-19 pandemic. That applies to all generations, and vaccinated children also offer protection for their family at home. Julia and her parents chose the jab because it makes them feel safer. The government hopes that many other families will now follow suit.